Well, the new generation of multi-sensor device, what they really allow to do compared to the previous generation that was based on motion only is to open two fields. One, we move away from the classical differentiation between wake and sleep pattern. Now with the introduction specifically of photoplethysmography, they are now capable to differentiate sleep stages. They also add additional features like temperature, for an example, that can be used also for modeling sleep onset time and so on. So the new feature set really advance and expand our potential for measuring different features of sleep, not only sleep and wake. And so we have the full sleep macrostructure, similar to what we are used to see in the polysomnography. On the other hand, the same feature that they use for modeling sleep and stages is used also for measuring directly several physiological parameters during the night. A big advantage is to being able to measure profile of heart rate variability, so it's a windows on the autonomic nervous system function during the night, and that is the multi-sensor technology that allow to do that. Different devices have different feature sets. Some devices, they also have a sensor for measuring environmental condition, and so potentially see whether or not light influence the way you sleep, whether or not temperature and humidity influence your sleep, and so on. So it's really kind of push forward the capability that they have and what they can measure. Also, clinical features start to appear on this device, like oxygen desaturation, oxygen saturation. They have an oximeter now. There are some use cases of this device using the combination of additional type of sensor that allow you to measure atrial fibrillation, for an example. Some of these devices have this FDA clear feature that build on the top of the classical continuous data streaming that they have. And we will see always to push for more feature and more use cases from these devices.